all my fiery little flocks. We are back today with another adequately acceptable episode where we are going to stitch together ideas and unravel some new topics. I'm Sarah Reed.
And I'm Joe Fox. What's happening, Miss Kiefer?
Not much.
Miss Reed?
Yeah, I was
Sorry
about to say.
about that.
I responded. I've been responding to that for 3 decades.
How is my favorite little 5-month-old?
Cute as shit. That's what I tell everybody. But he's in his pterodactyl phase. We call him Dak.
Okay.
Because he's screaming all the time.
Yeah.
What I have not been able to do having a 5-month-old is any sort of crafting. And so I tried to go into this episode with crafting puns, and I don't know how to craft. I started needle pointing. Do you craft?
At one point I was in scrapbooking. I'm not gonna lie.
Our guest today, I think, is probably going to outdo us both when it comes to crafting.
Our guest today is a pretty unique, special person, and I'm excited. Right? We have many awesome partners here at MB2. Get to meet a lot of incredible clinicians that also happen to be great business owners. Those two things, in and of themselves, are not easy to do. Right? Mm-mm. But then this person also happens to be a super mom, and just generally a very interesting, cool person. So, without further ado, I would love to welcome Dr. Wendy Steger.
Thank you for being here. I love that this is a full circle moment for me because she bought the minority interest at my father-in-law's practice. Wow. But you should see, if I had to count the amount of texts I have from my father-in-law saying, I'm really excited for you to meet this doctor, it'd at least be like 3 or 4.
Oh my God. Well, he's an incredible human as well.
So from the notes, you have a very interesting story of how you got started with an interest in dentistry. Can you share that with our listener?
So I started in dentistry at 15, and so I went to a very unique practice in Austin. He was an orthodontist and a pediatric dentist, and he treated me from basically the moment we moved to Texas when I was 10 or 11 to basically when he kicked me out when I was done with college at 21. So
he's like,
I've spent, I know, please, I think you need to graduate to a regular dentist. So, I've just grown. I feel like I grew up in his practice. He took me under his wing when I was 15. It was just, I came into one of my ortho visits and he's like, are you even interested in dentistry? And honestly, at that time, I wanted to be a marine biologist before that point. And then he asked me, and I was like, you know what? Maybe I should just try. And our high school had this really cool program where you could go and work part-time during school. And so it was really cool to be able to work in his office. So I started off as his sterile tech, actually.
How cool.
So I was just sterilizing instruments and then took x-rays. Then I was an assistant. Then one summer he asked me to be his lab tech. So I did ortho lab tech for a long time, actually. And then another summer he's like, well, Wendy, I think we're going to go digital. And I'm like, oh, okay, cool. So guess who got to scan in all the charts, got to put in all the notes in the new program. Wow. Yeah, that was my whole summer. So I think I just got to learn so many different things in the office. And it was also the culture that he created in our office that really inspired me to continue to become a dentist after that.
How cool. And never veered from then on?
No, never veered. Okay, I will say it took me a few times to get into dental school. The very last time I did, the last time I applied, I prayed to God and I said, you know what? God, if you don't want me to be a dentist, like I totally understand it. I guess I'll just be a kindergarten teacher. Because I love kids and I'm really good with kids. And if you want me to be a kindergarten teacher, like I totally understand.
Say so.
Yeah, no, just say so. Just let me know. And legitimately 2 weeks later, I got my acceptance letter to Baylor. So
I love it.
Anyway, that's kind of my.
So why general dentistry and not ortho or peds?
I know, that's such a great question.
Thank you.
I think going through dental school, I think peds was the goal. And then it kind of changed and I kind of wanted to do OS too. Mm. And then when I graduated, I just loved dentistry so much that I just didn't want to be tethered down to any one thing. And so that's just kind of what I went with. When I graduated, I did a ton of implant and extraction courses. And then I kind of took a veer and focused more on cosmetic dentistry, functional dentistry, and so that's kind of how it kind of developed.
Can I ask what might be a dumb question? What's functional dentistry?
I think for me, functional dentistry is how do we connect the mouth and the body together?
Holistic.
Oh, yeah. Okay.
Not holistically, but more of like, well, if there's inflammation in the mouth, like why is that causing inflammation in the rest of the body? So there's really a huge
Holistically, not holistically.
yeah, like whole body
Yeah.
health, which I really think there needs to be more people talking about it, because it's not just the filling, it's not just a deep cleaning, it's really about your whole body health.
Yeah.
Yeah.
Yeah, absolutely. I mean, the connection with tightness in this region, jaw
Yeah.
and neck, to
Well,
the
now-
hips and
Well, now they
hamstrings
say
and
like
such.
inflammation in your mouth is connected to over 70 different systemic diseases in the body.
Yep.
So
Yeah,
That's insane.
Yeah.
That's like one of the cool frontiers of
Yeah.
that AI is helping. Is
Yes.
that there are some perspectives that dentists will become kind of the managers of healthcare for everybody.
yeah, and I definitely agree with that.
Yeah, that's super
I
cool.
think whenever I first truly believed that there was such a connection between the mouth and the rest of the body, and this is such a dumb example, and I hear it as it's coming out of my mouth. My sister has this Chihuahua. I think Princess passed away, but she had this Chihuahua, and his eye like swelled up, and it was because he had an infection in one of his teeth. Like somehow something happened where it was like you could see it on the face, but it wasn't because of anything in the face. It was something in the mouth, and I was like, oh, it makes sense. Granted, I was not in this industry because that would be really embarrassing, but it was an interesting vision into the connection that happens between the mouth and the rest of the body.
Yeah.
And a tiny little baby dog.
And to be fair, most patients don't realize there's a connection until someone tells them.
Yeah. Or until you can like see it.
Right.
Yeah.
Well, I mean, that's a function of just how the U.S. healthcare system is based,
Yes.
right? You have these specialists in their silos,
Right.
and other parts of the world have more of a integrated.
Well, I think
approach.
also in our medical climate right now, it's how do we prescribe to the symptom? How do we treat the symptom? It's not how do we prevent the symptom, right? So there's definitely a difference.
Yeah, absolutely.
And I know you just told us the story of the evolution of your dental career from sterile tech to practice owner.
Yeah.
How do you feel like having the role of sterile tech assistant, digitizing charts, working in an ortho lab, how do you think that those prepared you to become a dentist and ultimately a business owner?
I think it gave me a different perspective on all the different team members. And I think a lot of times practice owners don't understand what it takes to do all of these different, positions. And so for me, it's really understanding what people need to be a better team member in that position. So I'm also a very highly efficient person. I have to be, because if I'm not, I can't do what I need to do.
Right.
So it helps me kind of say, hey, I know the struggles that you're going through, but there's also a better way to do this so that we can all be better team members together. So I think that's the perspective that it gives me.
That's fascinating. That's special. Did that help with dental school at all?
Oh, yeah.
Right.
I mean, how many times did people ask me to bend their ortho wires in ortho lab? Yeah. I mean, I left after the lecture. I didn't even sit in lab because I could do that in like 30 seconds.
On the job training.
Yeah.
I love that. Or reading
it was
charts.
great. I mean, even like models. I mean, my orthodontist, I thought I was OCD. Looking back now, I'm like, he was even more OCD than me. I mean, he would want his ortho models in like a certain angle. Like everything, he would have like a little thing that he would just measure every little corner on, just models to study. So I'm like, I mean, model trimming and doing all that stuff was so easy in dental school. I mean, I was in and out of lab.
How cool.
Yeah.
What about dental school did you find challenging then?
Honestly, the didactic part.
Didactics.
all the science, that was a lot. I mean, not that we couldn't get it through, but there's just so much information that they pump into you first and second year. Wow. So I was happy to be in lab. I'm like, okay, yeah, let me
do
through all
something
this.
hands-on.
Yeah, and that was my favorite. And I will say, even that part, even though I make it sound like it was easy, I had really amazing professors that still really pushed me. I mean, I had this one professor, I mean, he would sign off other people's stuff and he would not sign my stuff. He would send me back at least five or six times every single time. He's like, well, no, I don't like this. And I'm like, did you look at this other student's wax up? it looks like and you're not going to sign my stuff up? Like, are you kidding me?
I was about to say, I know it drove you nuts at the
But
time.
that really drove me nuts. But that
it.
really, now looking back, I know why he did it now, because he really just wanted to keep pushing me to do even better than I was.
Absolutely.
So,
Wow.
yeah.
So you're a newish owner. How
Newish.
is that going?
It's very new. I don't think we've even hit, I think not even 6 months yet. I mean, it's very, very new. Yeah. So, yeah.
Yeah, that was right around the time I went on maternity leave.
I think so. Yeah.
At what point?
Actually, it was the weekend. I signed my papers the Friday before you had the baby.
3 hours and apart from the birth of my son. So, like 30 weeks and 2 days. I have no idea how long it's actually been. At what point in your journey of dentistry did you know that you wanted to do something even greater than being a dentist, like becoming a practice owner? Is that something that you knew from the point you said dentistry is it? Or did that kind of evolve as you got more comfortable with leadership?
I think it evolved. I knew graduating from dental school, I knew I wanted to be a practice owner eventually. But I also knew that I had so much to learn in so many different aspects of dentistry that I wasn't ready when I graduated. So it took me some time to kind of pick and choose different positions to kind of understand the different parts of dentistry before I wanted to own. But I'll be honest, whenever I got asked to join Campbell Crossing, I was very clear that this was my next step.
Yeah.
Yeah.
You knew when you were ready.
Yes.
Yeah, absolutely. Yeah. How many of your classmates do you think knew that they wanted to be owners or did want to be owners at the time? Dental school classmates?
I would say probably a handful.
Yeah, really? Like not that much?
Not very many.
Interesting.
And I think the climate's a little different now. I think, maybe 30 years ago it was a lot different owning a practice than it is now. Now a lot of us struggle with a ton of student debt. And if you can imagine having student debt and also taking on a big loan, that's very difficult as a new grad. So.
Yeah, we see that a lot with owner transitions and trying to find the right fit is a lot of times people just aren't in a financial situation.
Exactly.
And other times it's a good opportunity for them to buy a portion of a practice rather than 100%.
Yeah.
I know you got involved, I believe it was in dental school, in organized dentistry.
Yes.
Can you talk a little bit about what that is and why it's important to you?
So for me, organized dentistry is a professional organization that helps us protect our profession and also advance our profession. And so, it happens at the national, state, and city level. It's just something that I've gravitated towards, not just for networking, but also the relationships and the mentors that I've met have really grown me as a person, a leader, and as a dentist.
Tell us more about the dental advocacy component of the.
So my fourth year, when I went to Capitol Hill, that was actually a really fun experience as a student because I was actually advocating for student loans, extension of student loans. So as a fourth year student, because I did my master's before dental school, when it came around to my fourth year, I had exhausted all of the federal loans that I could take out. So actually my fourth year, I actually worked part-time as a bartender to be able to pay for my boards, my two boards, the written and the patient exam portion. So, having to go through that in dental school, I wanted to advocate just for dental students or, any graduate students to get more federal loans because there is a cutoff for that. And I don't think that's fair for anybody to be going through during dental school.
Yeah.
Where do you think that interest in advocacy comes from? Like, as you're sitting here saying it, I'm like, I wish I had that drive. Like, I think about my mom and, before I was born, my mom would protest and march and do things that she believed in. And I've never had that, I've never been drawn to that. Where do you think for you that comes from?
I don't really know. I think for me, it's if I'm not going to do it, who's going to do it for me? And it's the same with representation to an organized dentistry. If I don't see a female agent up there advocating for me, then who's going to do it for me?
Yeah.
It's going to be me or none. And that's just my perspective.
Yeah.
I don't think everybody has that perspective. I think people have little fires, and once you feed that fire, it definitely becomes something.
Yeah.
Yeah.
I think that's called leadership.
Yeah.
So what is it like being an exceptional clinician, a business owner?
I think earlier I mentioned being highly efficient. I've had to learn to really time manage, and also just to be able to do all the things that I do. And my kids know too. Like when I'm home, I am home with them and we're spending the time together because I know that's the only time that I have with them. So that's just being able to allocate time where it needs to be allocated. But when I'm gone, I am like efficient. We've got to get this done.
Yeah.
Same at the office. I'm like, I got to get all this stuff done before I get home. I don't have the luxury to be here until 8 or 9 at night to do stuff. So I think being able to, and I don't think I'm that balanced either, but I do make time for myself. I wake up at 4:30 to work out every other day.
I was about to say, how do you make
Yeah.
time for yourself? And you said I wake up at 4:30. And I was like, nah, I don't need to
Yeah.
make time for myself. That's fine.
And then I do go to bed earlier than most people. So it's just things like that and to your point, Sarah, like you'll get into the groove. Like you'll come up with like your schedule and things like that. And I'm also I don't want to be a dentist 5 days a week. Like I just can't, because I need to do other things too. So yeah.
One of the things I've thought of, and this is a selfish question for a podcast for other people, but is the example that I'm leaving for my son. Like for me, it's important that I have a career and I am producing something that I'm proud of. Yeah. What is the legacy you hope to leave behind for your kids when you think about what they're saying about their childhood and who their mom was?
Yeah. I think I obviously want my kids to have the most fun possible, the great memories. And I hope that they remember all those fun family memories that we have. But also I want them to grow up knowing, mom, whenever she wanted to do something, she put her mind to it, she was going to do it. And I would say when I was studying for my FAGD exam, that was really hard for me because at the time, the baby was, I don't even think he was a year when I was studying for it. And then my daughter at the time kept going, Mommy, how long are you going to keep studying for this exam? And I'm like, I know, baby. As soon as I pass it, I'm going to be done, baby. And I think it's just so important for her to see me go through that, to like be working and being with her and doing all that, because she can do that too when she's older. It's not, I don't want her to hit a ceiling where she feels like she can only be one thing.
Yeah.
She can be all the different things too.
That's awesome. I love that.
Yeah.
What have you found comes naturally to you as a business owner, and what has kind of surprised you as a business owner? I know it's only been 6 months, but I feel like that's kind of the sweet spot.
Oh, gosh. I think I'm a naturally compassionate and empathetic person. And I think that's also developed through being a mother as well. And so I think in terms of like listening to what the team wants, that has kind of come naturally for me. Now, I feel like I'm not as good at managing my time now because I'm being pulled so many different ways as an owner in the office that I didn't used to be.
Oh, yeah.
So that's definitely something that I'm struggling and learning to kind of figure that out.
I could totally see that.
Yeah.
Having that staff perspective is pretty special and
Yeah.
unique. I'm sure there are very few dentist owners that actually have that, right?
Right, exactly.
Wow. What are you most excited about clinically going forward? I know you're very serious about your CE and kind of pushing the boundaries. Like what's coming? Like,
so I just finished taking the first part of my COIS training, and that was really interesting. And that's kind of why I brought up the whole body dentistry, because I think that's what's most interesting for me is how do we connect medical and dental together? The integration needs to be worked on. Oftentimes I always call myself, when I ask patients, hey, do you have acid reflux? And they're like, what? Nobody's ever asked me that. And I'm like, okay, well, you're gonna have to go to your MD and see if they can test you for it. Just tell them, hey, your crazy dentist wants to know if you have any acid reflux. I shouldn't have to say that.
Yeah, exactly.
Right? It should be like, my dentist told me she sees, erosion on my teeth. I want to get tested for acid reflux.
Right.
It shouldn't be like me putting myself kind of down to like make it seem like I'm not telling the MD what they're doing.
Right.
Right. So I think that's definitely coming down the line for dentistry. People are going to realize that connection more. And then I also think AI is going to be really big in dentistry. And obviously everybody knows that. How it's going to be applied and when is going to be interesting to see how it gets integrated.
And specifically as it relates to AI, being able to identify these things that you're seeing as a dentist and being able to say, okay, when we see XYZ on a on a scan, it is indicative of this, this, and this.
Right.
And then being able to get that patient to the right
exactly.
person, care provider.
Yeah.
That's special.
Yeah.
That's special. How do dentists and MD, how are they going to integrate?
Yeah, that was my
What's the
question.
step?
Like, that's got to be the first step, right?
I mean, don't you guys kind of do school together, right?
No.
First year,
we
there's not
don't.
shared at some schools?
Not, at least not at our school.
Okay,
We
interesting.
didn't. And we didn't really have any interaction with the medical students at all.
Yeah.
That might be where it starts. But I think it's just building a relationship with those practitioners in whichever area that you're in is probably going to be the easiest. And also one of the other big things is cardiologists too, right? A lot of these things are connected with the heart and high blood pressure, things like that. So I think just making personal connections with those people, that's how it's going to have to work slowly.
When I mean, the science is the science, right? The science is the science. And so when insurance companies really embrace all the things you're saying, right?
We would hope, right?
They're going to kind of force that change. They're going to mandate that change, right? And so that's kind of a really cool like future.
And that also brings in like advocacy too, because if dentists aren't going to advocate for that connection too, then it's going to take a lot longer.
Yeah, absolutely.
Yeah.
Absolutely. Wow. Awesome. Tell us about your birth story. You got a really special birth story.
Oh, so not very many people know that I'm actually Canadian. I'm from Toronto, so we moved to Texas when I was in 5th grade, and it was
You
so
went from
funny.
Toronto to Texas?
Yes,
Bless your heart.
in the summer.
Yeah.
So I remember at the end of the school year, I told my teachers in Toronto, I'm moving to Texas. And they're like, oh, yeah, you're probably going to be riding some horses and stuff like that to school. And I was like, oh, okay. So
horses are cute.
Yeah. Well, I actually have a fear of horses. So I was like, oh, great.
They're
okay.
big animals.
Awesome. Yeah, they are. And so when we moved to Texas, I was like, everything's fine. There's cars
Where are
here.
the
Like,
horses?
where are
No
the
horses?
horses?
Ah!
I was just like, where are the horses? So anyways, I did not ride to school on a horse.
They do in
God,
Garland, though, I think, don't they?
They do in Garland.
They do not.
Yeah. But it was a very hot summer. I do remember thinking, why is it so hot here?
And you're
Like,
I've
what
never
is wrong
stopped
with this
thinking
place?
that.
Yeah, I still haven't stopped thinking that. But I will say I would rather be in the hot than the cold. So I grew up there, and then I grew up for the rest of my childhood in Austin, went to high school in Austin, and also went to UT. So I'm a Longhorn.
Yeah, hook 'em.
And then I moved up to Dallas to do my master's in research, and then I went to dental school.
Love it.
Yeah, and then we actually bought our house when I was in dental school. I got married after my first year of dental school. I don't recommend that to anybody young listening, because that was just, it was the best experience, but it was a lot after, to do all that in first year.
Yeah.
So, and then we stuck around in that house ever since.
For young dentists that are getting started in their career and that are interested in a destination of practice ownership, what advice do you have for them, and what lessons do you hope they learn prior to becoming practice owners?
I think probably a couple of the biggest things that I would say is take some business classes ASAP. Because the sooner you understand the business aspect of dentistry, the easier your transition into ownership will be. And then also invest in your education, because whatever you learned in dentistry is not real life dentistry.
Yeah.
It's far from it. So, just take as much CE as you can. Honestly, if you're a dental student listening to this, take as much CE as you can as a dental student, because most of the time it's free as a dental student or highly discounted. So,
Yeah, that's interesting.
yeah.
Where can dental school students get that business training? You just like co-op classes that happen to be related to the university, or like what do you like?
Maybe,
online resources,
but
or-
there are some dental business courses. I can't remember off the top of my head. I actually just recently, I know you guys had Cal Stanley on the podcast a couple months ago.
Yeah, Dr. Stanley's
He
great.
actually has a business course that I just took this past January that was very good. So I guess I could put a plug in for
Boom,
him.
awesome.
That was a really good
Yeah,
business CE that I took online virtually. Yeah.
awesome. Why do you think those courses don't exist as part of the normal curriculum?
I think it's because if you think about it, dentistry is 4 years of med school and 2 years of clinical pushed into 4 years. So we're getting all our didactic that they're trying to cram in, and they're also trying to cram in like 2 years of experience in dentistry for those students. So there's just not enough time in the day for them to teach them that. And so that kind of falls a little bit down the totem pole.
Yeah, absolutely.
Yeah.
Can I just real quick, best restaurant in Dallas?
Shoyo right now, unfortunately, it is closing down at the end of the month. So they're probably going to be moving somewhere else. Yeah. Wow. So their lease is up. Their 5-year lease is up. So
What is this place?
it's an omakase sushi restaurant. So we're really good friends with Chef Jimmy, and we've actually been friends with him for a couple restaurants now that we've followed him. So I think Shoyo is the best experience you can get out there for sushi, omakase. You don't even have to pick what you're eating. He's just going to serve you.
Wow.
So that's our fave right now.
And what do you think the issue was? Like the location or?
Well, honestly, it's the lease. The lease is up. They're kind of
Same
growing out of the
story.
space. They're just a 12-seater. They do 2 seatings a day. And so you can only imagine how much growth you can have with just 12 seats.
Yeah.
So,
Where's it at? Where's it at?
it's Lower Greenville.
Oh, okay.
Yeah.
So what's Chef Jimmy going to do next?
I don't know. I will find out for you guys.
Okay.
Please, and
For the
report
next
back.
episode.
Yes, I will have to report back.
Thank you for that.
Yes. Yes, but that is the best.
Okay. Crafting. What is your craft of choice? Listen, I'm looking for hobbies. This is an active search that I'm in.
You have the bedazzled
I
jellies.
literally just sit there and stare at my child all the time. So
Yeah.
what do I do
So
instead?
my cricut used to be my craft of choice.
Okay.
Now I have a 6.5-year-old and a 2.5-year-old, and there's not very much time to design in cricut anymore.
Oh, I can
So I
imagine.
Canva everything now.
Okay, fair.
So that's my crafting. I craft everything from Canva now.
Okay, so what do you do with what is it like shirts? Is it like cups?
So I
Is
can
it-
do shirts, I can do cups, I can do invitations, anything. I mean, I do all my marketing stuff for the office. I design all those
that's
too.
cool.
So Canva is like my new crafting thing that I do. Yeah.
That is so awesome.
So like, let's say we're getting a basket for our specialist. I'll do some, ChatGPT does help me.
obviously.
And then I'll kind of design the tags for those and put those on those gifts for the docs.
Have you named your chat? What? Was that a stupid question?
I don't know.
No, I have not. I have not. I didn't know that was a thing, but now I have to think about mine.
Mine's Kathy. One, of course, she's a woman. And two, because she's Chatty Kathy. Am I the only one
love
that's done
that.
this?
I love that. Oh my gosh. I'm going to think about that.
We're in a monogamous relationship, so I felt like it was only fair.
Yeah.
Okay, I have one last question. How do you feel like, if it does at all, success looks different for you now? Like than when you were graduating dental school and you were thinking about what would make you feel successful versus now? What's changed, or does that look the exact same as it always has?
I think it's definitely changed for me because I feel like what I thought success was when I graduated is totally different now. Now that I have 2 kids and, we have our little family, I think it's, when you're younger, you're like, how much money should I make to make me happy, right? And then you get to that number and you're like, okay, well, how much more can I make to make me even happier? Okay, you get to that
goalpost
point
keeps
and it
moving.
just keeps moving. Now I think for me, it's like, well, how do we make memories and how do we just be happy with what we have, right? It's not like I'm trying to get to the next goalpost. It's, well, what can I do now to provide my kids with all these memories, like take them to Disney or take them to the beach or take them out of the country, things like that. That's what I think is what I see success as. And also, like you mentioned earlier, like what legacy am I creating for my kids too?
That's a good answer.
Yeah.
What do you think dentistry looks like in the next 10 years?
Oh gosh, that's a hard question. Lots of digital dentistry, I think, is coming down the line, and I think it's going to be interesting to see how people keep up with that.
Yeah.
I mean, there's something new all the time.
And do you think that's a good thing, or it's a?
I think it's good.
Yeah.
I think it's good because it, along the lines of it's more efficient. And so when we're more efficient with our time and our treatment, then we're better serving our patients at a higher level.
Yeah.
Yeah.
It'll be
Makes total
interesting to
sense.
see how
Yeah.
it plays out.
Yeah,
Yeah.
absolutely.
For sure.
Absolutely.
Yeah.
Is there anything we didn't ask you about that you wanted to touch on?
I don't think so.
Awesome. Well, thank you so much for being here.
Yeah.
I know it
Thank
was
you
a
for
long
having
drive.
me.
Appreciate you.
Yeah.
Listeners, thank you for joining us for another great episode of the MB2 Underground podcast.
See ya.
Thank you.